Hello and welcome. My name is Calliope and I am going to be performing your chiropractic assessment today. How are you doing today? Okay. Well, I hope by the time you leave the office here, we've got you started on a good plan to get you to a spot where you feel much, much better. All right? Okay. So first, I'd like to take down some information from you, okay? I have a little bit of your medical history here. Some of the forms that you filled out before you came here, right? Okay, so then we'll just be going over those real quick and getting a little bit of a better picture about what you're dealing with, okay? So if you could just confirm your name and date of birth for me. Okay. Very good. And is that your preferred name, and how do you like to be addressed? Okay. Very good. All right. So let's go ahead and start with our medical history, your personal pain history, and then we will get into our examination, okay? So first, are there any changes that need to be made to the medical history that you have provided us? Okay. And what about your family history? Anything new there? Okay. And what about allergies? Anything there? Right. And what about your medication list? Is that correct and up to date? Okay. Very good. All right. So let's go ahead and talk about what we are seeing you here for, okay? So if you wouldn't mind just telling me a little bit about what you're experiencing, what kind of pain has brought you here to seek treatment. Okay. All right. Right. Okay. Okay. And this pain that you're talking about, are you currently experiencing that pain? Okay. And if you could just point out to me, I know you described it a bit, but if you could just point with your finger as best as you can where it starts and when it stops. Okay. I see. All right. Okay. Very good. Thank you. All right. And on a scale from 1 to 10, how bad is that pain, with 1 being not bothersome at all and 10 being the worst pain you've ever experienced? Okay, very good. Thank you. So I'm going to ask about this pain, okay? So is it pretty localized, or do you feel it radiate to other parts of your body? Does it shoot down your arms, your legs? Do you feel it in other places at all? And do you find that it tends to be worse on the left side, the right side, or right in the center? Okay, very good. All right. And what kind of quality of pain is it? Is it sharp? Is it dull? Is it throbbing? Does it feel like needles? Is it more of a pressure? What kind of pain are you feeling with this? Okay, very good. And to the best of your ability, can you remember when the pain started or what you think may have perhaps caused the pain, if you think maybe it's an injury or some sort of repetitive motion that you do? Okay. All right, very good. And are you finding that you're having other symptoms with this pain? Are you finding that you're having any headaches or muscle weakness, any numbness, tingling, anything of that sort? Okay. All right. Now I'm going to ask you a few questions about what you do, okay? So, what is your occupation? Okay. Alrighty. And do you believe that you are generally sitting or standing in life, not necessarily at work, but in life in general? What would you say you do the majority of? Okay. Right. Do you tend to lift heavy weights? Do you work some bit of a manual labor? Do you find that you are in any sort of position that would compromise your posture at all? I know those are a few different questions all in one. Let's start with, do you feel that you lift some pretty heavy weights, whether it's with your job, with any hobbies, or perhaps at the gym? Okay. All right. And now, do you think that maybe there's any sort of position that you're in regularly that is compromising your posture? Like, for example, are you slouching over a lot if you're sitting day to day? Perhaps if you're writing, drawing, working on the computer, are you slouched over, or are you in some way compromising your posture doing activities like that? Okay. All right. And how do you generally feel your posture is overall? Okay. Do you find yourself either slouching forward, or that your neck is perhaps craning forward a lot? Are your shoulders hitched up? Are you finding any of that ringing a bell for you? Okay. Okay. All right. So that gives us a pretty good picture about what we need to look for, what could be going on. Okay. So with our assessment today, we're not going to be doing any adjusting just yet, because I really want to get the full picture of what's going on with your body, what's going on that is causing you so much pain, okay? So we're going to start with our examination. We do a lot of orthopedic testing, muscle testing. We check on your reflexes. We'll do a couple x-rays at the end, okay? We want to get a real full, vibrant picture of how your body works, where it's maybe working a little too hard, or where maybe we have some weakness or deficiency, okay? So with these tests, it is quite likely that you will feel some discomfort or perhaps some pain. It's kind of the nature of these things, is we want to test what your pain-free range of motion is and what exactly triggers your pain or discomfort, okay? If it gets to be too much, you can let me know and we can stop, we can take a break or disregard that, okay? All right, so I'm just going to sanitize my hands real quick, all right? And then we're going to get started with checking a couple of your vitals, all right? So, sanitizer. So let's go ahead and start with your blood pressure, okay? So I'm just going to pop in a stethoscope, and then we're going to grab the sphygmomanometer here. Now for the rest of the examination from this point on, I am going to need to be touching you. Is that okay with you? To have your permission to do that? Okay, very good. So, do you have any preference as to which arm I put the blood pressure cuff on? Okay. Right, so I'm just going to take the dial there and the stethoscope, and I'm just going to inflate the cuff here. Good. And let's just do that one more time. I'm just going to take that off. And take out the stethoscope. And take your heart rate, okay? So I'm just going to take your pulse on the other side, right? So just go ahead and relax. Okay. Alrighty, so that's about 80 beats per minute. Very good. Alright, so now we're going to start the assessment. So first I'm going to stand up. I'm going to walk behind you, and we're going to take a look at your posture. We'll do some different tests, okay? I'll let you know what I'm doing the whole time so that you're well aware, all right? And again, remember, if anything is too uncomfortable, please just let me know, all right? Okay, so just going to grab this. Alrighty, so I'm gonna have you stand up for me, okay? Give you just a second for that. And then if you could just keep your feet about shoulder width apart, all right? Okay, I want you to just relax, all right? I don't want you to force yourself to stand in a certain position. I just want you to relax, all right? So I'm just taking a look at your posture here. So I want to see, is there a shoulder higher than the other? Do your hips look like they're in alignment or not? Is your neck a little too far forward? Are we seeing any issues with the different curvatures of the spine? Would you mind just bending your head all the way forwards for me? Okay, are you feeling any pain or tightness in that? All right, and you can go ahead and put your head in neutral. And if you could bend it backwards as far as you can. Any pain or tightness with this? Okay, you can go ahead and put it in neutral. Now I want you to take a deep breath in for me and close your eyes. All right, you can exhale. Just looking how your body moves and how it relaxes. Okay, so now we're going to do a little bit of range of movement testing, all right? So if you could just tip your head from side to side, so we'll do this laterally. So if you want to try to touch your right ear to your right shoulder, okay? Good, and how is that? Are you feeling any pain or tenderness there? Okay, and go ahead and put back to neutral. Then if you could tilt your head to the other side for me. Okay, any pain or tightness there? Very good, okay. If you want to put your head back to neutral. Now I'm gonna have you move your head from side to side, all right? So if you could just turn your head all the way to the right. Any pain or tenderness here? Okay, and if you could turn your head all the way to the left, as far as you can. And any pain or tightness with this. Okay, I'm gonna do a couple more tests here. Can you tip your whole body to one side? So if you want to move your whole body as best as you can towards the right. Okay, and to the left. Without twisting, just tipping. Okay, any pain or tightness with that? All right, now if you want to twist, rotate at the waist all the way to the right. Okay, and all the way to the left. All right, any pain or tightness anywhere with that? All right, and if you could bend forward to touch your toes or as far forward as you can. Okay, any pain or tightness anywhere here? All right, if you want to slowly come up. And if you could bend backwards as far as possible. Okay, any pain or tightness there? All right, excellent. So you can go ahead and get back to the neutral position, okay? All right, I'm just gonna come around to the front here. And just sit right back in front of you. So now we're going to be doing some different muscle testing, okay? So first, if you could just hold your arms up to the side, okay? So that you're making a 90-degree angle with your arm and your side, okay? You can just hold your arm forward, right? If you could hold that position, I'm going to try to press down on your elbows. I want you to resist me, okay? So I'm just going to try to press down here. Okay. And try to press down here. Okay. Now I'm going to try to press up I want you to resist me again. Trying to press up. And trying to press up here. Okay, now if you could hold your arms straight out with your palms facing the walls there. So your palms are like this, arms are straight out, okay? All right, now I'm going to try to press on your elbows down. I want you to resist me, okay? All right. Okay, all good. I'm going to try to press you up. I want you to resist me. Okay, very good. You can go ahead and put your arms down. Let me take a couple quick notes here. Now, if you could hold your arms up like this, okay, so your elbows are bent, arms are at a 90-degree angle, all right? I'm going to try to push against you, and I want you to resist me, okay? Try to push, resist me, and I'm going to try to pull you towards me. I want you to resist me. Okay, very good. Now, I want you to make little pinchers with your fingers here, okay? I'm going to try to pull your fingers apart. I want you to resist me, okay? So just squeeze your fingers together, okay? And squeeze your fingers together. Very good. Very good. So now I'm going to have you curl your fingers in towards your palm, okay? I'm going to try to push them out. I want you to resist me, okay? I'm going to try to push them out, okay? And now I'm going to try to push your fingers inwards, and I want you to resist me. Okay? And now if you could splay your fingers out for me. Right? I'm going to try to push them together. I want you to resist me. Resist against me pushing. Okay? Resist against me pushing. Good. Now if you could keep your hands like this and try to splay them against me. Okay, try to splay your fingers. And try to splay your fingers. I'm going to take a couple of notes and then we're going to work on your legs. Okay, so I'm going to put my hands on top of your thighs. I want you to push them up towards the ceiling while I am pushing down, okay? I want you to resist me. All right, very good. And I am going to try to push your knees together. I want you to resist me. Okay, and I am going to have you try to press your knees outwards against my resistance, okay? Very good. You got some strong legs there. Now I'm going to do a couple of resistance tests with your lower legs. So if you could just press your leg and try to move it upwards against me. Okay, and the other leg, press it up against me. Okay, and now I'm going to try to pull your legs forward. I want you to resist me. Okay, very good. And now with your feet here, I'm just going to try to push your foot downwards. I want you to resist me. The other side. And press down, resist me. Okay, and now I'm going to be pulling your feet up, and I want you to resist me. All right, very good. Okay, so now we're going to do some different tests again and some more examination. We're going to do quite a few different tests with you laying on your stomach. We're also going to do some with you lying on your back, okay? So I'm going to be a little out of view for a while, all right? So let's go ahead and let's start with you on your stomach, okay? So if you could just flip over on the table and we'll start getting you all tested. All right, so we've got you all laid out on your stomach, okay? Are you comfortable like this? All right, I just want to make sure. So again, let me know if there's any discomfort. So we're gonna do a spinal examination here, and we're also gonna do some tests again, all right? So first, I'm gonna start by checking your leg lengths, okay? So if I come back here and I look at your leg lengths, I can see that you've got a little bit of a difference here in the lengths. Now, sometimes people just have one leg that's longer than the other. So then what we do is we take the legs, and I'm just going to lift up your ankles and bend your knees. So then we can check the tops of your feet, and those are equal. So that tells us that anatomically your legs aren't two different lengths. It tells us that there is something that is impinging one leg so that it's a little shorter than the other, okay? So I'm just gonna put your legs down here, all right? And I wanna feel around your sacrum, okay? So your sacrum is at the base of your spine, right? And a lot of people get a lot of low back pain in the sacrum area. So I just want to feel around here. Are you noticing any soreness, any pain when I am palpating along the sacrum here? Okay, a little bit. All right. So I'm just going to do a little test here. I'm going to put one hand on your sacrum here. And what I want you to do, I want you to lock one of your legs, okay? Lock the knee so that your leg is stick straight. And then I want you to lift it off the table as high as you can, okay? All right, that looks good. You can go ahead and lower it. Now if you could do that to the other leg. Okay, so definitely that leg that was shorter has a little bit of a difficult time there, right? You can put it back down. So there's definitely something that's going on there, right? So we can feel around the spine, we can feel around the sacrum, and I think we'll have to do some adjustments later on in this area. So let's see, if I feel around the spine here, it definitely feels like there are a couple of twisted vertebrae here. So yeah, definitely in this lumbar area, there's a couple that are out of alignment, and that can definitely contribute to your pain back here. Let me just keep working up the spine here. Are you finding that there's any pain or any discomfort? Okay, so right here. All right, and that is right on the curve of your spine up here. So your spine, as you well know, should have a few different bends in it, and there's often quite a bit of stress in the places where our spine bends, and that's kind of what we're looking at here as well. So I'd like to see, this bend is a little bit compromised here, but we can work on that as well. So let's keep working up the spine here. Any pain or tenderness with any of this? Okay. if I just press into the muscles here? Okay, so that's definitely tender there. All right, just keep working along there and right there. Okay. All right. Okay, so there's definitely a few different places that we're going to have to focus on with our treatment plan. So I'm going to have you go ahead and flip over onto your back, all right? And then we'll do some more testing. Alrighty, so welcome back. Now we're going to be doing quite a few different tests. This is known as orthopedic testing, of course, with your legs, and we'll do a little bit with your chest. We'll do some with your head, okay? So again, let me know if there is any pain or discomfort with these that is a little too strong to handle, all right? We're going to start with a straight leg raise. So I'll come back over here and we're going to lift one leg straight up as far as we can, okay? And I want you to let me know if you feel any pain, any sharp pain in your back or down your leg, okay? So I'm just going to take your leg, I'm going to lift that up, right? Feeling any tightness or pain? Okay, it's a little tight. Are you feeling any sharp pain? Okay, that's good. Let's put your leg down here. All right, and then the other one. I'm just gonna lift that up. Okay, and right about here. Okay, any pain or tightness? Not as much. All right, and any sharp pain in the back or down your leg? Okay, so I'm going to do a little quick test here. I'm going to be flexing your foot forward pretty quickly, okay, while I've got it raised. And any pain with this? Okay, that's good. All right, so I am going to keep your leg lifted. I want you to hold this position, okay? I'm going to try to push down. I want you to hold this position as best as you can, right? Just hold. Okay, good. And now I'm just going to cross your leg over the other. And I want you to just drop your knee down, okay? Don't hold it up, just drop it down. So I'm going to push down on your knee. And what I'm doing is I'm testing your hips, okay? So let me know if there's any pain or tightness with this. Anything here? Okay, so now I'm going to move to the other leg. So we did that straight leg raise, but we didn't finish the rest. So I'm going to bring your foot up again, or your leg, and I'm just going to flex your foot forward quickly while it's raised. Any pain here? Any sharp pains? Okay, I'm going to keep your leg lifted here. I want you to hold this position. I'm going to try to push down. I want you to hold the position. Okay, just go ahead and hold. All right, good. And now I'm just going to cross this leg over the other side. And if you could just drop your knee down. There you go. So I'm going to push the knee down and we'll test the hip. Okay, any pain or tightness here? All right, good. So now I'm going to move to the head of you, right? So I am going to lift up your head and I'm going to hold your sternum down, okay? I want you to let me know if there's any pain here. Okay, any pain when I lift your head? Okay, you feeling somewhere on the sternum? All right, but nothing in the neck or down the arm, right? Okay, let me go ahead and feel around your sternum here. Any soreness here? Any tenderness? Okay, do you find that your sternum pops a lot, whether you move a certain way or when you're stretching? Okay, that doesn't surprise me. All right, So now I'm going to put my hand on top of your head. I want you to press up against me. Okay? And now I'm going to put my hand under your head. I want you to press back against me. So press towards the table. Good. Now I'm going to have you tilt your head, so move it so that your right ear is looking to touch your right shoulder, and I want you to do that against my hand. Okay, and the other side, try to touch your left ear to your left shoulder against my hand. Good. Now we're going to have you turn your head to the left and right against my hand. So if you could turn your head. Good. And then turn your head against my hand. Okay, very good. All right, let's go ahead and get you set up back on the table. All right, welcome back. So the last thing we have to do is take you to go get some x-rays done. So our x-ray room is just the next room over. So I'm going to go ahead and take you over there. We'll get a couple x-rays done. We like to do one of the neck and one of the full back, all right? And then afterwards, we'll come right back here and we'll discuss a bit about what we found and what we're going to do from here, okay? All right, so let's go ahead and go to the other room. We are back. So everything was done easy peasy, right? Okay. So I'll still have to review those x-rays, but you already knew this. There is quite a lot going on here. So certainly we're seeing some subluxation or some dysfunction in the neck area, right? You had some pain and tightness with some of those tests. Your shoulder is a little raised on one side, and to compensate, the hip on the other side is lowered. So you're a bit tilted. We're gonna have to work on getting you realigned, okay? And I felt the vertebrae, and a couple of them were turned a bit awkwardly. They're a little twisted. So we'll go ahead and work on those as well, okay? So the next time you come back, we'll go ahead, I'm just gonna note this down. We're gonna go ahead and get that all taken care of, okay? Good, all right. So the next time we'll do the manual adjustments, and then from there we'll keep working on those structures to make sure that they don't shift out again, or if you have something happen, if something gets out of alignment again, then we can do some maintenance as time goes on, okay? You have any questions for me at all? Okay, so yeah, I think with this plan, we can either do once a week for, let's say, I'd say about 5 to 6 weeks, or we can do twice a week, and that can be about 2 to 3 weeks, okay? So it's really up to you on what works best for you, and we can work with your schedule, and then if you need any maintenance visits after that, we can certainly get those squared away, okay? You have any other questions for me? All right, so thank you so much for coming here to my chiropractic practice. I really hope that we are able to get you fixed up. I see this stuff you're dealing with quite often. It's really not rare at all, and I've seen many, many, many people that are able to achieve a more pain-free life with better posture, better structural integrity, okay? So I hope that you have a whale of a day and a good rest of your night. Thank you,